Welcome to the webinar from the Center for Translation and Implementation Research. My name is Tonia Onyeka. I'm the program manager for CTER. And today we're going to be having a very interesting webinar. Today we're going to be having the privilege of three distinguished professors in their fields of endeavor. And we're going to be listening to them as they speak to us about participatory group model building. First, in no particular order, except maybe the order of the flyer on the screen, is I'm going to be talking about Patty Gravitt. She's the Deputy Director of the Center for Global Health. In this role, she leads the implementation science efforts and provides scientific and programmatic direction for all the research and training and partnership and dissemination goals in the center. Her background is as a professor of global health and a molecular epidemiologist who has researched in human papillomavirus and cervical cancer, and it spans from the natural history of genital infection across the lifespan to translation of evidence-based prevention tools in low and middle-income countries. She was among the first to show an increase in screening coverage afforded by self-collected sampling and HPV testing, and the relatively poor performance of visual inspection methods where intensive international technical assistance and training were not available. Her PhD was from the Johns Hopkins University Bloomberg School of Public Health, and her master's in biology from the University of North Carolina. Her most cited work happens to be the work that is titled Improved Amplification of Genital Human Papillomaviruses, which has over 1,000 citations. Our next speaker is Peter Hoffman, and he is Pamela B. Davis Professor of Medicine and Professor Center for Community Health Integration, School of Medicine, and Professor of Biomedical Engineering, Case School of Engineering at Case Western Reserve University. Prior to joining the Center for the Community Health Integration, Dr. Hoffman founded and led the Brown School Social System Design Lab at Washington University in St. Louis. Dr. Hoffman's research focuses on advancing system science methods for understanding and preventing structural violence with a specific focus on advancing knowledge on a multi-level feedback system. Dr. Hoffman is the author of Community-Based System Dynamics and has 17 years of experience in designing training teams and facilitating group model building workshops in communities and organizations all over the world. And our third speaker today is Valerie Paz-Soldern. She's a Peruvian American social scientist who is based in Peru as the director of Chilene's Health Office for Latin America. She's also an associate professor who obtained her PhD in maternal and child health with a minor in population studies, for which she took courses in demography, health econometrics, health policy, and qualitative research. And she has used mixed methods for a lot of her work, especially in reproductive health in Malawi. For the past 18 years, she's been funded by several high-profile institutions in the world, including Wellcome Trust, Gates Foundation, the NIH Fogarty. She has been the lead social scientist on various multidisciplinary teams to examine human behaviors associated with infectious disease transmission, prevention, and control. And she applies both qualitative and quantitative methods to her research in order to improve knowledge of adoption of infectious disease prevention control practices, both at the individual and organizational level. And with this said, I'd like to welcome Patty, Peter, and Valerie to the meeting this afternoon. And I say the floor is yours. Thank you.
Wonderful, thank you. It was such an honor for us to be here. And I think what I'm going to do to go a little bit out of order from what was presented on the flyer is we're going to start with Peter giving us an introduction to participatory group model building. And then Valerie and I are going to show how we've used participatory group model building as part of a mixed methods analysis to do implementation research in cervical cancer screening. So Peter, I'm going to turn the floor over to you first.
Sounds good. Well, thank you for the opportunity to join this afternoon and share some of the work, and really looking forward to helping to sort of set up the context for what Patty and Valerie will share. So I was asked to give a little bit of a background to group model building and the way it's being applied, different forms. And to start this off, I'd like to begin with this particular picture. This is from some work we're doing in India with Foundation for Ecological Security, and my colleague Gautam Yadama, who's now at Boston College School of Social Work. And what I like about this picture is this is some work looking at how to manage and water resources, drawing a lot on Ellen Ostrom's work and participatory role appraisal. And after about 2 weeks of work with this particular village in Andhra Pradesh at the time, the folks, the villagers here are actually presenting and talking about their system. There's the research team, the academics are outside observing, and you see a number of different symbols and conventions being used and being introduced by participants. So from my perspective, this ability to introduce conventions and develop that capability within a community context is at the heart of group model building. So part of what motivates this work, as was set up in the introduction, is this idea of structural violence, and why we would want to try to understand the structure of a system. I draw a lot on Galton's work, where he's drawing a distinction between the personal event, personal violence, or the event. So this might be a cardiac event, it might be a birth, a complication, and then the underlying propensity and the systems that produce that structure of risk. And one of Galton's key points here is that exposure to this continuous pattern over time may have often has a cumulative effect that is much larger than the sum of the events. And so the way I like to think about this is the distinction between understanding the system where we have some status quo or feared scenario, underlying propensity, and some desired hope. And this being the gap that we're trying to close and forming a dynamic problem, and in particular, understanding the system underneath the structure. So when we think about implementation, prevention, public health, population health, we're trying to understand